Hey friend, welcome back to LW Pharmacy Technician School channel. I hope that you are having a good week. I am having a good week. I am super excited about what we're going to cover today. We're going to be talking about insulins and diabetes and just all kind of things that you need to know in order to remember these insulin drugs. I know that insulins are a part of the exam, and that's something that we should all be aware of. And it is something that some of us struggle to remember. So get your paper, get your pen, and hop on in because we are getting started right now. I always like for us to think about what we're thinking and being mindful of where we are today. In order for you to retain this information, friend, you want to make sure you are aware of your thoughts. Be aware of how you're feeling. Check in with yourself every day. Check in with yourself every so often to make sure that you're not harboring any unforgiveness towards yourself, any frustration or irritation towards yourself. Check in with you. Your thoughts become things. So if you are still thinking about not passing the exam before, or if you're still thinking about what didn't go right at work today, or if you're thinking about how you're going to pay for something and you don't have enough money for it, you're giving love to things that cause fear, and you're giving love to things that don't make you happy. The best thing you can do in any situation is be grateful and focus your thoughts on the things that are working. Because when you focus on things that are working, more things will come to you and it will help you solve the thing that is causing you sorrow. Okay, so make sure you are paying attention to what you're thinking and that you are aware of your thoughts. If you have not subscribed to this channel, make sure you subscribe, ring the bell for notifications, give this video a thumbs up so we can get into the algorithm and we can help more people like you. You all have asked for tutorials. You all have asked for one-on-one time, and we're giving it to you. Every Thursday, 5 or more students are gathering with LW Pharmacy Technician School, $30 at a time, and they are spending 1 hour to study, not just with the instructors from LW, but also with other individuals who are like-minded. So if this is your first time taking the board exam and you don't know what to expect, the Zoom tutorials are good for you. If this is your second time and you've taken the exam before and you're nervous, the Zoom tutorials are for you, okay? I think it's a very good way to rub shoulders, to get in contact, to start networking in the industry that you're getting in and stepping in. Because remember, one day the person on the side of you may be your coworker, okay? LinkedIn is so fun and special because it allows you to connect with people who are already working in the space that you would want to be in or that you may desire to be in. And if you knew them from school, then you're like, hey girl, remember me? Or hey friend, look at me, you know, whatever the case may be. So don't sleep on it. What we're going to cover today is we need to know what are diabetes, where to store short-acting insulins, and which insulins are short-acting, because not all insulins are short-acting. And what does short-acting insulins even mean? You know, like, child, what is a short-acting insulin? I need to know, okay? One of the things that a lot of people tend to do is they like to group everybody in a category, meaning they have this preconceived notion that if their parents had a disease or a condition, they too are going to have it. A lot of times people think that diabetes and high blood pressure and high cholesterol is hereditary. And we know that's not true. Because baby, your mama could have hazel eyes and your eyes can come out just as dark brown as they want to be. So why is it that if that's the case with that, then why is it that diabetes or high cholesterol, high blood pressure can't be the same? You know, so when you say, well, mama, why you got these eyes? And, you know, they might say, well, maybe it jumped your, you know, maybe it skipped your generation. I don't know why you didn't get it. right? And that's the answer. You go on with that. You believe that, you're good with that. But when it comes to these chronic conditions and or diseases, a lot of people tend to just accept it. They're like, I know that at some point the mom had high blood pressure, the dad had high blood pressure, so at some point the child is going to get it. No, it's not hereditary. It's what you're eating. It's what's in your pantry. It's what's in your refrigerator. It says that if you look at this, the father had diabetes, so on and so forth. It said it's in your pantry. It's in your kitchen. It's in your fridge. The genes load the gun. The diet and the lifestyle pulls the trigger. Diet and the lifestyle pulls the trigger, okay? So if someone has diabetes, it's not because it's been passed down because the mommy and the daddy had it. It's because a lot of the times we grow up eating the same foods that our parents ate, which are the same foods that their parents ate, which are the same foods that their parents ate, so on and so forth. And because everyone is eating the same foods, doing the same thing, the same pattern is repeating over and over and over again. If you want to see a change, do something that you've never done before and you'll get an outcome you've never seen, okay? Do not accept what has happened in the past to be the normal for the future. Not just with diabetes, that is with every aspect of your life, friend. You create your future. You have the power to tell your future what it's going to do, when it's going to do it, and how fast you want it to do it, right? So you don't have to accept what happened in the past as what's going to be in the future. No. Baby, you get to create. You are the author of your own fate. You get to create how much you're willing to believe in you, how much you're willing to change, how much you're willing to give in order to receive something new, okay? So the whole idea of it happened in the past, this happened to them, get that out your head, okay? Make up your own story. You are worth it. What is diabetes? Diabetes is when there's too much sugar in the blood. That's the easy way to put it. Diabetes is when there's too much sugar in the blood. I exercise 4 times a week. I try to make sure that I exercise no less than 4 times a week. Well, really, that's stretching it. So no less than 3 times a week, right? Sometimes I can only make it 1 day a week because of my schedule. And then there are times when I can make it 2 days a week. And then there are times when I hit the mark, baby, and I'm there every day to work out, right? And I remember when I first started working out, I felt like, because I've actually been working out off and on since like maybe my teenage years. So I would go off and on and I would like do the treadmill and stuff like that. And I would go and walk in the park or whatever, with a waistband on. And so about 2 years ago during the pandemic, my husband started to do a lot of traveling with work. And I was like, okay, he's traveling with work. These kids are in the house with me because it's the pandemic. Everybody's home. And I'm working from home at this time. And I'm like, I need something, that I can call my own. Something that is mine. Because as a parent and as a wife, as a mom, as a daughter, it's so easy to get caught up in helping everyone else that you forget about yourself. And so I just started working out. I said, first I'm going to start with yoga. So I started with yoga. Yoga went fine. Because at that moment, it wasn't about the changing of my body. It was about getting something that made me feel like I did something for me. And something that made me feel good about Lindsay, right? So I started working out, and it was also for my mental capacity because you're going through so much. Exercising is a great way to reduce stress and to get all of that, what is it, the cortisone, and I don't know if I'm saying that right, but all of the stress out of your body. So I started working out. I started with yoga, and then I started with bar. And then, no, I started with yoga, then Pilates, and then bar, right? So I don't do yoga as much as I used to. I actually pulled something in yoga not too long ago, but anywho, I do bar and Pilates more. And when I don't go, I can tell the difference in not just my body, but in my mood, in myself, right? And so I was reading and just looking, as I was putting this presentation together for you, I was just looking at what is diabetes and how can you prevent it. And one of the ways you can prevent it is by exercising and keeping the body moving, right? Now, at one point in time, there was somebody who I knew who had diabetes but don't have them anymore. And that particular person did a lot of exercising and just changed their diets, and now they don't have it anymore. So I know that it says that there's no cure for it. However, if the individual changes their diet and or changes their lifestyle, it can prevent it and or cure it for some people. Okay. I'm just telling you what somebody else has told me. I am not a doctor. I do not have a license as a doctor or a physician. But I do know individuals who've had things that are no longer there. Okay. So when I think about too much sugar in the blood, it reminds me that, hey, you need to get the body moving. You need to make sure the body is moving. You need to make sure that the body is being active, that we are making great choices at the restaurants, that when we pull through the Chick-fil-A line, this is my story, I need to order that kale salad and stop getting those French fries every time I see them. Okay, I'm talking to me, I ain't talking to you. Pre-diabetes. So pre-diabetes is when the sugar level is higher than normal. Okay, it says that 86 million people have pre-diabetes. And it just means that the sugar level is higher than normal. Now, with diet and exercise, they could possibly change that, and that number could decrease. But we all know that a lot of times when we get off work, we don't want to work out. We want to give quick food because we're starving by the time we get off, or we're tired, or whatever the case may be. But I will tell you, friend, that even with memorizing this information, the more you stay active, the more your brain is open and active, and all of the other stress from everyday life, because we all know that even though you're studying for this, you're still an adult. You're still an individual with responsibilities, right? So we need to keep the body going. We desire to keep the body going because we desire to have a long life, right? A long, healthy, fruitful life. And there are things that are going to be given to us in this life that we want to see, and not see it from a hospital bed or see it from a walker or a cane, but we want to experience it, right? We want to live a fruitful, healthy, peaceful life, right? So getting the body active, staying active, making better choices. That doesn't mean that you go in your refrigerator right now and you throw away all of the things that are negative and you say, I'm throwing this ice cream away, I'm throwing this bread, these chips, these cookies, they got to go. No, it just means that tonight you're going to make a choice, okay? Instead of the French fries, let me get fruit, right? Instead of the French fries, let me get a salad. Lindsay, my story, not yours, right? So it's just all about making little bitty changes that add up to big outcomes and big results, okay? So always remember, it's the little things that you do that makes the big picture. I used to tell people that when you think about it, the key is smaller than the door. Any door that you've ever opened, your key is smaller than that door. It does not take a big key to open a big door. All it takes is the right key at the right time. Okay, friend? Don't you forget that. Type 1 diabetes is where the individual is, dependent on insulin, and the body is unable to produce insulin, right? So this is where they now have to use man-made insulin for the body to trick the body into thinking that, yeah, where everything is good, you're making the insulin, so on and so forth, and they're insulin dependent, okay? So if someone has type 1 diabetes, write this down. Type 1 diabetes is insulin dependent, okay? We'll talk about type 2 diabetes in the next video, okay? As a matter of fact, if you want to know about type 2 diabetes, drop it in the comment. Yes, please teach on type 2 diabetes because I would love to do a segment on that as well. But insulin dependent is when they are, their body is not making the insulin that the body needs in order to stay functioning appropriately in the way that it should. This little cat tickled me so much because when I thought about this little cat and I thought about you, and I said, my friend be doing too much. My friend be doing too much. My friend is reading from this book, studying from this app, looking at this channel, looking at that channel, using somebody else's stuff, asking people at work. You reaching and you grabbing. Baby, reaching and grabbing with no direction, okay? Doing too much. Like this little cat. Baby, look at that little cat just gone. Baby, gone, okay? Look, friend, I told you before, all you need is 30 minutes of study time every 4 hours. 30 minutes every 4 hours, okay? You don't have to study from 55,000 different resources, indoor study materials to pass this board exam, okay? Baby, get you one good book. Baby, get you one good book, okay? Everything that you know, everything that I have been teaching you, everything you know came from this book, honey. When I tell you everything you know came from, everything that you've gotten from LW has come from this book. There is no reason for you to be out here in these streets studying from every which way. It is like eating Chinese food, Mexican food, and American food all at the same time. I don't know what that tastes like, and I'm not interested, okay? Get your book and study from your book 30 minutes. Set you a timer, 30 minutes every 4 hours. Set you a timer for the 30 minutes. Once the 30 minutes is up, set a timer for the 4 hours. Make time for what you want, okay? Because we make time for what we want. If it's anything else, make time for what's going to increase them pockets, because you know that the holidays are here. I told somebody yesterday that they was coming. Baby, they here because it is 40-something degrees in Houston. So you know they here, okay? Short-acting insulin. Look at Miss Juicy. Miss Juicy say, my steps may be shorter, but they ordered. I know that's right. Tell her, Miss Juicy. Short-acting insulins also can be known as rapid or short-acting insulins, and they are used to help reduce the blood glucose level at mealtimes, right? So a lot of times people will take this 30 minutes before a meal, and when they take it 30 minutes before a meal, it allows that to get into the body and to begin working the way that it should, okay? It says they can take it at meal times, so on and so forth. Doctors give different orders for different reasons, and they give different orders to different patients because the body for each patient is different. I want to talk about this for a second. Let's make sure that we all can agree on that doctors are trained to treat the symptoms and to manage the disease, and that the pharmacist is trained on the medications, what is used to treat, and the side effects, okay? I say that because a lot of times individuals go to the doctor and they're looking at this doctor and they're expecting the doctor to know everything about the medication. And they get upset with the doctor when the doctor does not know everything about the medication that the pharmacist would know. And a lot of times they put more emphasis on the doctor than they do on the pharmacy. And I think there's a lack of education happening in our community because many people want to rely and, they really want to be upset with the doctor and they want the doctor to pay, and they're, you said this medicine would do this, and you said this medicine would do that. Well, you have to remember, A, that your body is not made like Susie's body. B, Derek's body, responded differently to the medication than your body. And C, they're trying to find what works for you, right? What works for the patient. And so I think, people are putting their faith sometimes in spaces where it doesn't always align. As a representative of healthcare, and as someone who's a part of the therapy process, like you yourself, or you're a pharmacy technician and you're a part of the therapy process, this is why we are involved, because what the doctor does is they manage the disease and they manage the symptoms. And then we are trained to manage the side effects, and we are trained to manage, not necessarily we, but the pharmacy is trained to manage the side effects. They're trained to tell them, about the dosage, what to expect, so on and so forth, right? When the doctor writes the prescription in the doctor's office, they write it and give it to you. When you go to the pharmacy to pick it up, they give it to you, and then they say, I want to tell you a little bit about this medication. So you tell me who got the knowledge, the doctor or the pharmacist. Okay. So with that being said, a lot of times people are reaching for answers from a doctor's office about something that they may have access to, but they may not be trained on 100%. Does that make sense? So it's like, I may have access, to make chicken, but someone who is at the chicken factory or someone who's a chef could possibly manipulate the chicken better than I can. Because there's only a few ways that I can probably put some chicken together. I can cook, don't play with it. But I just want you to remember that in the pharmacy, you're in the pharmacy and your job is to know about this medication, right? Because you're operating underneath the pharmacy. When we think about short-acting insulins, we're thinking about Novolog, we're thinking about Apidra, we're thinking about Humalog, and we're thinking about Humulin R. Write these down. These are all short-acting insulins, right? These are all short-acting insulins. Okay, friend? I want you to write those down. Okay? Now, this one says how to store Novolog and Apidra. Now, when people are storing this medication, they can either keep it at room temperature or they can refrigerate it, okay? It says to discard after 28 days. So when you think about the days in a month, most of the time, you're going to have either 30 days in a month, that's average. Some months have 31, like October, and then some months have 28, like February. So it's easier for them to say, hey, discard after 28 days, because a lot of times in pharmacy, we always want to make sure that the patient has just enough. We don't want them to need something and not have what they need. Okay, so write this down, Novolog. And then I also want you to pay attention to the generic name. So Novolog is the brand, hence the R right here. And then insulin aspart is the generic. Okay, make sure you write that down. It also comes in 100 units per ml. So that means that for every unit that they draw up, they're going to get, for every milliliter they draw up, they're going to get 100 units. Okay, so this is my lip gloss. We're gonna just use this for demonstration purposes. And here we are. This is the insulin here, and this is the needle. And we're gonna go in, and we're going to draw just about 10. Let's see. We're gonna do 1 milliliter. So if we do 1 milliliter, that's 100 units. If we do 2 milliliters, that's 200 units, so on and so forth. I want you to write this down. Most, okay? I just want to make sure I had your attention. Most insulins come in 100 units per milliliter. 100 units per 1 ml. Okay, that's how most insulins are put together, and that's how most of them are dispensed. If you look at Apidra, it's the same thing, 100 units per milliliter. So a lot of times when you get a calculation question that's asking about insulins, it's not going to always tell you that it's 100 units because the author is expecting you as the pharmacy technician to think in that manner. This is why, again, I was saying when we were talking about the doctor in the pharmacy earlier, is because I want you to always remember you're in medicine, honey. Your job is in medicine, baby. And if you don't know anything else, you know medicine, right? You know medicine. You know more about medicine than you give credit for, okay, friend? So when they come to the pharmacy and they're asking for their medication, they are trusting us to do it correctly. So when you take that board exam and that board exam mentions Apidra, or it may mention it as insulin with the G name that I'm not even going to attempt, it may mention it like that. And if it does, they're automatically expecting you to know that there is 100 units per ml. Write this down. Most insulins are in the form of 100 units per ml. Okay, this is a very important sheet right here. The next one is how to store Humalog and Humulin R. These are very popular. These are very popular insulins, by the way. Okay, and Humalog. Let's start here. Humalog also comes in 100 units per what milliliter. I'm telling you what I know. Write this down. And then if you look very closely here, you can see that it is insulin Lispro or Lispro. That's the generic. Write that down. Because again, when you are in the exam, they may refer to it as a generic. And for insulins, there can be multiple brand names that are attached to one generic name. So you do want to make sure you're aware of that. If you want to learn more about that, drop a comment below. Say, I want to learn more about the brand names and the generic names of insulins, and we can come up with another segment, okay? But for this one, it should be room or refrigerated, room temperature or refrigerated. That's the temperature that it should be stored at. And you should discard it after 28 days, okay? When we look at Humulin R, it should be room or refrigerated. So either way is fine. And it should be discarded after 31 days, okay? Humulin R, same thing, 100 units per 1 ml. I hope you've written it down by now. I just hope that you have written it down by now, friend, because everything I keep telling you, it continues to happen. Now, I want to know what you know. Did you know that insulin, let me ask you this. Can insulin be purchased without a prescription, yes or no? Yes, it can. Okay. The only ones that cannot be purchased without a prescription is Lantus, Humalog, and Novolog. Write that down. There are 3 insulins that cannot be purchased without a prescription. Lantus, Humalog, and Novolog are the 3. All of the other insulins can be purchased without a prescription. Isn't that fun to know? Isn't that fun to know? If you have not subscribed to this channel, please make sure you subscribe, give this video a thumbs up, ring the bell for notifications so other people can see what we're doing at LW and you can continue to help us spread the love. Okay. Bring and tell me something. Tell me something good. Tell me. Okay, tell me something good because look, you done been in here with me this entire time. You ought to know something, friend. I know you do. I believe in you. I got faith in you. Which of the following is classified as a short-acting insulin? Now, I just told you, write down them generic names. See, you didn't think it was going to come back around. That's what it was. You didn't think it was gonna come, but baby, it done came back around. And it's in the flesh. What you gonna do? A, B, or C? A, B, or C? And if you picked A, you got it right. Okay? If you picked A, you got it right. Go, friend, go, friend, go. You are one step closer to passing that board exam. Listen, Linda, listen, Linda, listen. Listen, Linda. Insulin is used to treat type 2 diabetes. True or false? Insulin is used to treat type 2 diabetes. True or false? False. If you put true on there, womp, womp. We have not really talked about type 2 diabetes, friend. I said if you wanted to learn about it, to let me know. Okay, quit playing. Well, looky. We are back to the Zoom tutorials. If you or someone you know is practicing to take an exam that is compiled of pharmacology, let them know that every Thursday we offer Zoom tutorials, 60 minutes at a time, okay? These Zoom tutorials can be done online from anywhere, anytime, okay? Your time may be 4 o'clock, my time may be 6 o'clock, right? If you want to RSVP, when you RSVP with the info button at the bottom, info@lwpschools.com, and we will make sure that you get in the room. Last Thursday, we had a room full, and we are so glad that you all are there and that you're coming. If you're watching this video right now, shout out to you for showing up for yourself and making sure that you get the most out of your sessions, because this is your time. You all are investing in these exams. You're putting forth, the money, and you're investing in yourself to reassure that you're going to get it. That is all that it takes, is with you doing what you're doing. So good job. Very proud of you. Friend, I will be dropping the link in this video for the book that you can get, so you can continue your studies, working with one book at a time. My background is blocking it, so you can't really see it, but I'm going to drop the link below. I am so proud of you. Continue to do your best. Don't give up. Don't give in. Don't give out. Okay. The fat lady has not sung. Okay. But thank you again for trusting me with your journey. I'm so happy that I got a chance to spend some time with you today. I will see you next week. Thank you so much, friend. Bye.